But thank you all for joining. My name is Jessie McGinty. I am the manager of strategic initiatives at DU's Health and Counseling Center. And today we're going to give you a brief overview on some of the services offered at the Health and Counseling Center, and hopefully have some time for a few questions if you have them at the end. So we'll go ahead and get started on this next slide. We'll talk a little bit about our mission. As DU's Health and Counseling Center, or HCC for short, our mission is to provide exceptional, inclusive, integrated healthcare for all DU students. We promote student success and wellness through education, advocacy, and outreach to all of the University of Denver community. All University of Denver students, whether part-time or full-time, undergraduate or graduate, can all use the HCC services. As the home for health and well-being, the HCC is committed to the principle of inclusivity and the promotion and celebration of diversity with respect to all of its forms. We are a multicultural, multidisciplinary, and multi-theoretical staff striving to provide culturally competent clinical services, medical treatment, outreach programming, advocacy, and training opportunities. And we are committed to providing a safe, welcoming, and affirming environment for all DU students. On this next slide, this is an overview of our structure, and we'll go into a little bit more detail further on, but this is the bird's eye view of all of our units. The HCC is an outpatient on-campus facility that provides a wide range of services, and our team of over 75 staff includes physicians, physician assistants, nurses, nurse practitioners, medical assistants, counselors, health educators, and a variety of other health professionals, as well as graduate and undergraduate level staff. The HCC is made up of the 6 units you see on the screen here. Our medical services team provides a wide variety of preventative and acute care services to help students get healthy and stay healthy. Our counseling team provides one-on-one, group, and outreach services to support students experiencing transitions, situational problems, crisis, or any long-standing mental health concerns. The Center for Advocacy, Prevention, and Empowerment, or CAPE for short, supports survivor healing by providing advocacy and support for victims of sexual assault, relationship violence, stalking, and sexual harassment. Our health promotion team focuses on prevention and educates and empowers students and shapes the campus community on topics including alcohol and other drugs, mental health, gender violence prevention, and sexual health. The Collegiate Recovery Community, or CRC for short, is one of the newer additions to the HCC, and it's a supportive community for students who are in recovery from substance use disorders. It's designed to provide academic excellence alongside recovery support to ensure that students do not have to sacrifice one for the other. And finally, our administration and finance team oversees all of the operations and finance for HCC, and they help keep all of the other units running smoothly and are the friendly faces and voices when you contact or visit the HCC. So the HCC is open on Monday through Friday, 8 a.m. to 5 p.m. on Mondays and Fridays, a brief late start on Tuesdays to account for team meetings, so open from 9 a.m. to 5. Wednesdays and Thursdays, we do have extended hours, so we're open until 7 p.m. And then we're closed Saturdays and Sundays and anytime the university shuts down for snow days and holidays. We have a few different locations on campus. And our main location, which houses medical and some of counseling services, is located in the Ritchie Center on the 3rd floor on the north side of the building. Another part of our counseling team is located at our Asbury location at the corner of University and Asbury. And the CRC is located on York Street, while health promotion is now located in our new community commons, and CAPE has just moved to an on-campus bungalow. If you are driving to us, the HCC Ritchie location does have reserved parking in front of the Ritchie Center for patients and clients. A permit is not needed. However, you just need to sign in your vehicle when you check in at the front desk. The Asbury location has 3 metered spaces for patients and clients, And at the CRC, there is street parking available on York Street and Asbury Avenue. To schedule an appointment and to learn about all of our teams and staff and services, as well as other resources, you can go to www.du.edu/HCC, and you can click on the My Health button to make an appointment. Now we'll go a little bit more in depth for some of the services that each unit provides. The HCC offers comprehensive primary and acute care. We provide routine health maintenance exams, ongoing preventative care, sick visits for a variety of issues such as colds, cough, sore throat, and the flu. We do offer same-day appointments and daily nurse triage for more urgent concerns. We also offer on-site rapid testing for the flu, strep, mono, HIV, and pregnancy, along with a full complement of sexually transmitted infections and laboratory testing options. Additional services include travel physicals, for instance, when traveling for study abroad, immunizations, IUD and Naplexanon insertion, services and support for transgender students, including continuation of transgender hormone therapy, guided and informed by best practices developed by the World Professional Association for Transgender Health, PrEP, and much more. Our services are all confidential and no information is released to anyone without students' written consent, except in the case of a life-threatening emergency or when otherwise required by law. For counseling services, whether you're experiencing a situational problem, a crisis, or have longstanding mental health concerns, counseling services is here to help. Our professional staff includes licensed psychologists and licensed social workers, as well as psychiatrists and graduate student staff from both disciplines. Our counseling services can help support your transition to DU or other transitions in life, as well as general development and growth. And again, all services are confidential and not released to anyone without student written consent, except in that case of life-threatening emergency or required by law. We do also have psychological testing, drug and alcohol abuse treatment, crisis intervention, and a variety of different outreach, workshops, and group support. The International Student Support Program also provides free 24/7 remote counseling and acculturation support to international students via the use of technology. Students can access this digital content as well as connect with clinical advisors that speak their language and understand their culture. And students can access this by downloading the MySSP app, calling the number here on the slide, or visiting us.myissp.com. When the HCC is closed, we are still available and you can call us at 303-871-2205 to speak with an on-call medical provider or an on-call counselor. If immediate care is needed when the HCC is closed, you can seek care from a local urgent care facility or a hospital emergency room. Two convenient options with the addresses and phone numbers are here on the slide, and they include the Care Now Urgent Care on Evans Avenue or the Porter Adventist Hospital. The Center for Advocacy, Prevention, and Empowerment, or CAPE, is here to support survivor healing and providing advocacy and support for survivors of sexual assault, relationship violence, stalking, and sexual harassment. It's also free and confidential, and they can help support finding safe housing, providing academic support, financial resources, medical care, legal resources, and court accompaniment, and also reporting to police and Title IX. The Department of Health Promotion educates and empowers students on topics including alcohol and other drugs, mental health, gender violence, and sexual health. We also shape the campus community to support health, well-being, and success. And some of the programs and services Health Promotion provides educational workshops and outreach activities available to campus groups and upon request. Campus-wide events such as the Love and Sex and Health Week, Mental Health Week, Sexual Assault Awareness Month, and Stress Reliever events. wellness resource stations at campus locations that provide free resources such as safer sex supplies and sunscreen, and other late night substance-free events. Health Promotion also houses 2 undergraduate peer education programs, one of which is our Intervene Peer Educators. They help educate the DU campus community on gender violence topics and bystander intervention. And they provide the Intervene DU active bystander trainings and outreach events such as Sexual Assault Awareness Month. Our Thrive Peer Educators also promote health on the DU campus through education and engagement. They develop programs and implement outreach efforts regarding sexual health, mental health, and alcohol and other drugs as well. And finally, our Collegiate Recovery Community at the University of Denver is an initiative to support students in recovery from substance use disorders. They offer a community lounge, substance-free social events, sober housing options, support meetings, peer mentoring, and educational seminars and events. The CRC is a supportive environment within the campus culture that really reinforces the decision to pursue sobriety. And it's designed to, again, provide that academic excellence alongside recovery support to ensure students do not have to sacrifice one for the other. So finally, here are a few email addresses if you have questions about specific programs within the HCC. You can also visit our website, www.du.edu/HCC for more information. If you'd like, you can also take a moment to put the HCC number and email address in your phone. That would be 303-871-2205 and info@hcc.du.edu. We also encourage you to follow our social media accounts, such as @Thrive@DU on Facebook, Instagram, and Twitter, where you can get important updates, events, as well as health and wellness tips. So at this time, I'd like to thank you all for your attention and invite you to ask any questions that you might have. So one question I see in the chat here is, are HCC services available for students who have a health insurance waiver? My understanding is that HCC is different than health insurance. Perhaps our Director of Administration and Finance can come off mute and answer that one for us.
Hello, I'm Chris Wera. I'm the Director of Finance and Administration for that.
Don't think we can hear you.
How about now? Nope.
The short answer is yes.
Okay, well, I'm going to go with the.
Oh, they can hear. Okay,
so,
I can.
My name is Chris Wera. I'm the Director of Finance and Administration for the Health and Counseling Center. I've been here for 17 years. And the best way to describe this is that it is not health insurance, but it is kind of a prepaid service for your students at a very low cost at convenient time. So the health and counseling fee allows you to get unlimited services, counseling or medical, generally with just a $20 copay for the quarter. We work around student schedules. We have online scheduling, and it's usually lower than copay premiums that you might have with your insurance. You can bill your insurance, but will be out of network. It would be considered out of network. We find that most students find it very convenient to work around their schedule and just walk across campus and to come to the Health and Counseling Center for almost all their healthcare needs. If it's emergency, or something more severe, we have nurse triage that they can call. Or if they call the front desk, they'll be transferred to a nurse, and the nurse will advise them either to come into the Health and Counseling Center or to go to an urgent care or emergency room, depending on the situation. And I'll just follow the next one. We don't take insurance. It's just basically that.
We have another question about
sometimes some nominal lab
how services are covered and if the HCC takes insurance.
That to your insurance,
and as well as
non-network cost. I'll grab the last question there. It will be put on the in your tuition bill for undergraduates carrying 6 or more credit hours. It's a required fee, so it'll just show up on your tuition bill. If you have your own insurance, the insurance will show up as well. If you have your own insurance, you'll need to go through the waiver system, and then that will come off your tuition bill. And then the question about the daughter has a therapist in the city she sees weekly. What we will do is we would set her up, we'd ask her to make an appointment, and you can do those pretty quickly once your student is registered, to have an initial consultation. And then depending on the issue and the severity, our counselors will try to match the care that your student's getting already. And yeah, it would be the $20 copay for each time.
Apologies, everyone. I had some issues hearing, so I'm not sure what question we're on now. So there's one question about someone has a daughter, their daughter has a therapist there in their city and sees weekly. Can she see someone here, and would it be the same person each week? Sounds like that one was answered. So we'll go, is this service incorporated in tuition, or is it a separate charge?
Hey, Jesse, I think I figured out what was going on my side. Do we need to answer the question about the health and counseling fee being on the tuition?
If you haven't already, apologies, I couldn't hear your answer, so
Yeah,
I'm not sure what has already been answered.
Just to repeat, the health and counseling fee does come on the tuition bill every quarter. So as long as when your student is carrying 6 or more credit hours, it'll just show up there on the tuition bill.
Great, thank you. Is counseling through the Health and Counseling Center only available to students if you opt into the DU health insurance plan? Is it on an unlimited basis if you have DU insurance? And what if you opt out and use private insurance?
So the health and counseling fee by itself will give you unlimited $20 counseling sessions, the standard 1 hour. If you have the health and counseling fee and the student health insurance, then for the first 20 visits, there are no copays at all. After that, there's a combination of co-insurance and copay that goes to about $40, just $45 per session. So for 21, visits 21 and on. We have very few students that actually get to that level. Most students are below 20. If you have your own insurance, you're still going to have the health and counseling fee. So it would just be the $20 copay for unlimited counseling visits.
Thank you. So if we don't do the waiver, we can do the $20 copay.
And I'm going to interpret, if we don't do the waiver, as if you waive the student health insurance because the health and counseling fee is required, you would have the $20 copay for both medical and counseling visits unlimited. We do have discounted lab charges. So if you have a medical exam and you have a rapid strep, for example, that would be $6. So it'd be $26. If you kept the DU student health insurance and you have the health and counseling fee because you cannot waive that, then there would be no copay for anything that's done on the medical side, and really only counseling visits above 21. Otherwise, everything would be completely covered 100%.
My son filled out much of his paperwork and said no to the insurance. Can we go back and sign up now? How would we go about that?
The best way to do that is to send an email to insurance@hcc.du.edu, and that will get to the insurance coordinator, and they can contact the bursar and have that reversed. It takes a couple days to do that, but it's easy to do.
Still a slight bit of confusion. Is it mandatory for students? What is the cost? And is there a copay? Is it included in tuition or separate? I think we have covered a few of those things.
Yeah, I'll just repeat because it is very confusing. The health and counseling fee is a mandatory fee. All by itself, it gives you $20 copay visits, unlimited number, and discounted lab tests if we have to do those. A lot of times we don't have to, but so it's a $20 copay system. The second part of that is the health and counseling fee is actually going to show up on the tuition every quarter. So it's going to be $225 every quarter, fall, winter, and spring. And that shows up in tuition. The copays are due at the time of the visit, or we can leave them on the student's account and they can go ahead and pay them at a later time. They'll get a billing reminder after the visit that they can have a link to go ahead and use a credit card or a card that is a HSA debit card, something like that. Those charges do not go onto the tuition bill, those copays. It's a completely separate. And we do that so that we can maintain the privacy of the students when they're over 18, even though you're supporting them. I'm supporting 3 kids right now, so I know exactly how it feels. But they are considered adults by federal and state law, and they have the ability to keep even their copays private if they want to. So I hope that answers that question.
Thank you. Let's see. Can you provide the link to all of this information? This is great information. It's just a lot to understand and digest. It absolutely is. And that link to the whole website for the HCC is down here at the bottom, www.du.edu/HCC. And there is a tab on the top about insurance and forms that has some of this information.
I'm going to answer a couple of the other questions. I know I'm missing a couple, so hopefully this answers it. If your student has a prescription and you would like to have it filled in state, there are 2 ways to do this. The first way is to go with a national chain like Walgreens or CVS. As long as you have it in there, they can pull up that information on the prescription and fill it just like you were at home. A lot of times we have about 70 different prescriptions, the most common prescriptions that we see our students need, that we keep in a small formulary. If they're typically about the same price as the generics, but a lot of students will want to fill them at the Health and Counseling Center. If that's the case, then we need to have the student meet with one of our providers. They will write the prescription and fill it at the Health and Counseling Center. Or as you see during cold and flu season, if they need some sort of a different prescription, we can write the prescription and fill it either at the Health and Counseling Center or at a Walgreens or CVS where you might have your insurance, out-of-state insurance or in-state insurance benefit. On the insurance is billed in 2 parts: on the fall tuition bill and on the spring tuition bill. The fall coverage period is basically from September 1 until spring break and to the end of spring break. And then the spring tuition or the spring period is from spring all the way from the first day of spring quarter all the way into August 31st. The cost for the year is $36.20. So it'd be billed $18.10 and $18.10. That would be in addition to the health and counseling fee. On the insurance card, once you enroll in the insurance, there's a waiver period that you have to do, or you do the enrollment during the same system, then you will get a United account, and you have two options. One is to download the United app, and then you'll have your insurance card on there, or you can choose the option to have an email sent to you with your insurance card. We have found that mailing the insurance cards, a lot of times students have not changed, especially in fall, their home address to their campus address. So it goes to the parents, and then the parents have to send it to them. It's a lot easier once they set up their United account to go ahead and just get the card there. Getting into the United account or the United app, they're kind of interchangeable. You'll be able to find your provider, your network of providers. You would find your costs, your deductible, how far you're on progressing towards any of those. So that's how you get the card. Okay, so to have a provider on campus, do you need to have the DU insurance? No, you do not. Because the students will be paying the health and counseling fee, all students on campus can use the health and counseling center and all the services we provide. So you don't have to have the DU student insurance. So for our undergraduates, we have about half of the students, a little more than half the students carry their parents' insurance, and somewhere around 40% will take the DU insurance. It just depends on the parents' policy, how well it covers students out of state. A lot of times you have an insurance policy that really covers you only in the state and just emergency care, so parents will choose to take the DU student health insurance plan. All right, I'm going to answer. Okay, if you have your own insurance, so you keep your own insurance, you're still going to have the health and counseling fee, so the copays are still going to be $20. And that's unlimited on the medical side and 20 on the counseling side. And we found that for 97% of students, 20 visits over the whole academic year is more than adequate. Most students do anywhere between 10 and 12 if they are in counseling, if they choose to do counseling. Copays are still $20 because you'll have that health and counseling fee if you have your own insurance.
Chris, there is one question. If we have power of attorney and release of info signed and notarized, can you share with parents?
Yes, and you can get that form. The student will have to fill out that form and authorize that. We have that pretty frequently, and that form is found on the HCC website.
I think we may have hit most of the questions. Some of them are similar. So hopefully they've all been answered. Is my understanding that max visits is 20?
No, that's not correct. On the medical side, both on the medical and the counseling side, it's unlimited number of visits for the year. Depending on if you have DU's health and counseling fee only, or if you have the DU's health and counseling fee and the university's student health insurance or your own insurance, the copays will vary once you get past, say, 20 visits on the counseling side. I guess the one more thing to say is that if you have any questions, the best way to get in touch with us is to go info@hcc.du.edu, and we get back to those questions fairly quickly.
A little bit of time for any additional questions or anything that needs clarification. All right, I don't see any new questions coming in. And of course, this was recorded, so it can be reviewed again later. And like Chris said, feel free to reach out to the email addresses here, and any additional questions can be answered via email. We appreciate everyone's